All righty. Well, welcome everybody. We're so excited to be here and to have you with us today watching on Facebook. My name is Sarah Talley. I am one of the nurse supervisors with Nurse Family Partnership here at the Children's Shelter. Today we have with us the UT Health School of Nursing students to present a really great PowerPoint about recognizing danger signs of pregnancy. So a little bit about our program, Nurse Family Partnership. We pair a registered nurse with first-time moms and their family, whoever they want to be involved with our visits. And that registered nurse can meet with you starting in pregnancy all the way up until your baby's 2 years old. In this program, we offer lots of resources, education, activities, just kind of covering lots of different things regarding your health and your baby. So if you're interested about our program or anything else at the Children's Shelter, look us up at thechildrensshelter.org, and you'll see stuff if you're interested in fostering, other parenting classes. We have some father programs, so lots of stuff out there. And I'll go ahead and turn it over to our first presenters here to get us started. All righty.
Hello, everyone. Today, like mentioned before, we are going to be going through recognizing danger signs during pregnancy. Oh, and by the way, my name is Fernando, and I'm a 6th semester nursing student at the UT Health Science Center. So some of the more common danger signs we see during pregnancy are listed below. So I'm going to go through them pretty briefly. So, and we'll also be going into more detail as the presentation goes on. First, we want to look out for a sudden gush of fluid from the vagina. We have vaginal bleeding, and then abdominal pain, temperature above 101.0, and chills that usually could indicate an infection. Dizziness, blurred vision, double vision could also be due to maybe hypertension in the mother. Persistent vomiting, known as hyperemesis gravida. We have severe headaches, swelling of the hands, face, legs, and feet, which is known as peripheral edema or angioedema. We have muscular irritability, convulsions, abnormally small amounts of urine. Then we have pain during urination, which also could indicate an infection, and then absence of fetal movement. So we're going to be going into more detail right now. So the main topics that we want to focus on today is abnormal bleeding, a condition known as premature rupture of membranes, infection, preeclampsia, urinary tract infection, dehydration, hyperemesis gravidum, no fetal movement, and the mental state of the pregnant mom. So talking about abnormal bleeding during pregnancy. So bleeding during pregnancy can be common depending on the situation, but in this situation, we're going to be talking about placenta previa. So this is basically when the placenta has implemented itself in the lower uterine segment instead of the upper portion. So as that lower uterine segment continues to dilate and contract throughout the pregnancy, there's a component called the placenta villi that's torn off from the uterine wall, and that causes minor or severe blood loss. And this usually occurs during the 2nd trimester. It's pretty rare to see it in the 3rd trimester. So what we should look out for, or i.e. the signs and symptoms, the main sign we should look out for is bright red vaginal bleeding, specifically without pain, and of course during the 2nd half of pregnancy. And then some moms might experience contractions along with the bleeding, the cramping, and lower back pressure. So interventions for placenta previa in terms of the medical profession as the nurse or the provider, it really depends on a multitude of factors that can include amount of bleeding by the mother, whether if the bleeding has stopped, the position of the actual placenta, and some other factors. So how we intervene when there is a little bit of blood or none at all is that as the provider or the nurse, we should record and document any sort of blood loss. We want to make sure that we continuously monitor the mother and the fetus because blood loss can cause complications for the heart rate of the fetus and of course the mother. So the provider might actually recommend to avoid like exercising or any other strenuous activities such as sex. When it comes to the opposite spectrum of having a larger amount of bleeding and heavy bleeding, this might require an emergency C-section. So it also might include a blood transfusion. So the thing you want to monitor is those heavy episodes of bleeding if they continue and they do not stop. So when you should actually contact your provider is if those, like I said, those episodes of heavy bleeding continue and they continue with pain, contractions, and this could eventually lead to an emergency C-section. So how would it affect the mom and the baby? Well, this could increase the risk for a premature and preterm rupture of membranes leading to preterm labor. And throughout the presentation, we will go over those the premature rupture of membranes into more detail. Another way this could affect the mother and the baby is if severe bleeding continues, because if that happens, the fetus will become hypoxic, meaning it loses oxygen. And some risk factors for this condition of placenta previa can include a pregnancy of more than one fetus, so maybe having a set of twins, and the age of 35 and up for the mother, being of non-white or Caucasian race, smoking, heavy use of cocaine, and previous pregnancies with it can include just general pregnancy or a pregnancy with placenta previa. And so I'm going to be giving this off to the next student so she could explain this slide.
Hello, my name is Adeline Arroyo. I'm also a sixth semester student here at UT Health. I'm going to go ahead and talk about premature rupture of membrane, also known as PROM. So I'm just going to go ahead and refer to it as PROM as I go on. So what is PROM? PROM is the rupture of the amniotic sac before labor begins. If this occurs before the 37 weeks of pregnancy, is considered preterm premature rupture of membranes, PPROM. So PROM accounts for about 8 to 10% of all pregnancies. It is also 1/4 to 1/3 cause of all preterm pregnancies. So risks for PROM, some risks include low socioeconomic conditions due to improper prenatal care, sexually transmitted infections, previous history of preterm births, vaginal bleeding, and cigarette smoking during pregnancy. PROM may also occur with no explanation at all. So what can you look out for? So usually you'll experience a leakage or a gush of fluid from the vagina. You can also notice constant wetness in the underwear. So if any of these occur, you do want to make sure and call your provider, as they can be symptoms of other medical conditions. So complications for PROM. Number one is infection. It's specifically chorioamnionitis, which is referring or relating to an infection with the amniotic fluid. And then there's also placental abruption, which is the detachment of the placenta, which can cause bleeding. You may or may not experience the bleeding through the vagina. Sometimes it'll stay concealed. So usually you can detect it with ultrasound. The next one is prolapse cord, which is when the umbilical cord exits the cervix before the baby's head. So this is a complication because therefore the baby can actually compress the umbilical cord and cut off its oxygen supply. So that's a little bit more on the severe. And then lastly, PROM may result in cesarean birth due to like the infection and all of that. Also, if you are experiencing the pre-prom, it's all most likely due to an infection. So you do want to make sure and call your provider if any of those symptoms do occur. So how to prevent prom? Unfortunately, there's no way to prevent prom, but there is a strong link associated with cigarette smoking. So you do want to make sure and to stop smoking as soon as possible when you find out that you're pregnant. It is also important to keep up with the prenatal checkups and just maintain a good diet. So I'm going to go ahead and pass this off to the next student. Thank you for listening.
Hello, everyone. My name is Edwin Sanabria, and I'm a sixth semester student here at UT Health. And first off, me and my colleagues are very excited to be here, and thank you all for listening. And whether you're into your pregnancy journey already or it's on the horizon for you, pregnancy is a very beautiful thing, but there are some complications that can happen during it. So we just want y'all all to know the signs to look out for, and infection is one of the leading causes for pregnancy complications. And there are many, many infections that can happen, but these are just some of the most common ones. So the effects on the baby that infections can have are many. They can lead to various birth defects such as hearing loss, blindness, learning difficulties, preterm labor, and even miscarriages. So the first infection we're going to talk about is called bacterial vaginosis. And it's actually the most common bacterial infection in women. And this infection increases the risk of ATIs, and it is believed to play a part in preterm labor. Some signs of this are vaginal discharge, itching, or an odor. Now, the next one is chlamydia, and this one is known to increase the risk for preterm labor. And if it's untreated, it can cause an eye infection or pneumonia in the baby. And some signs of this are vaginal pain and discharge. Our next infection is gonorrhea, and this one has been linked to miscarriages, preterm birth and low birth weight, premature rupture of membranes, and infections surrounding the fetus and the uterus. Some signs of this are fever, frequent urination, sore throat, pus-like discharge, painful urination, and pain in the lower abdomen. Now, seeing here, you could notice a pattern that a lot of these infections are transmitted through sexual intercourse. So while the chances of becoming pregnant again during pregnancy are very, very low, I'm not sure if it's impossible, you're still not protected from these sexually transmitted infections. So it is highly recommended to use condoms to protect not only you, but your unborn baby. And so the next infection is listeria. And this one can cause a loss of the pregnancy or a stillbirth, premature birth, or life-threatening infections in the newborn. And some signs of this are diarrhea, fever, muscle pain, joint pain, headaches, stiff neck, backache, chills, and light sensitivity. And for this infection, it is acquired by eating uncooked foods. So we want to avoid any soft cheeses, any deli meats, any meats not cooked thoroughly. So we want to cook our food thoroughly and heat up any deli meats or any cold foods during pregnancy. And now some general signs of just general infections or fevers, chills, fatigue, an overall feeling of just not well, body aches. You could have swollen lymph nodes in your face, neck, or around your head. So sore throats, congestion, runny nose, sneezing, loss of smell, pain, redness. If you have a cut or a laceration, any pain, redness, or pus coming from that is a sign of infection. And so you want to contact your doctor. It's better to be safe just to get it checked out. If you experience any of these signs, and he'll set you up with an appointment to just make sure, because the sooner you identify an infection and the faster you treat it, the better the outcome will be for your baby. And So some of the important things to keep in mind are to wash your hands constantly. Hand hygiene is one of the best ways to prevent the spread of infections, and also being around sick people. And I'm going to pass it on to my colleague, Justin. So thank you all for listening.
Oh, thank you, Edwin. Appreciate you introducing me already. How's it going, guys? My name is Justin, and just like my colleagues, I'm a sixth semester student. So I want this to be a little light. I don't want anyone to be scared. For those who are here with us, I appreciate it. If you have any questions, just put them there in the chat. We can do our best to answer it, okay? So what we're gonna go over next is UTIs. UTI is a urinary tract infection. It's an infection of the renal system. You can see here in the slide, I don't know if you can see me circling around, but upper urinary tract is going to contain the kidneys, ureters, bladder, and urethra is going to be in the lower tract. So this whole thing right here is going to be the renal system. So an infection of the renal system can be either lower or upper. Like I said, lower is down here, the urethra and bladder. Upper is going to be the kidney and ureters. So what bacteria or any type of viruses try to do is they get into your urethra and infect your bladder, and they swim up here through the ureters and attack your kidneys, and that's what we don't want. So some of the risk factors, there's the female anatomy. So females have shorter urethras than men, so they're more prone to those urinary tract infections. Sexual activity and not doing the proper hygiene afterwards. After sexual intercourse, you should definitely go use the restroom to clear all bacteria out of your urethra. An impaired immune system as well. So an impaired immune system will allow those bacteria and viruses to colonize your renal system and allow the infection to go up into your kidneys right here, okay? So signs and symptoms. For the lower urinary tract, which is going to be your urethra and your bladder, you're going to have difficulty urinating, or that's called dysuria. A low-grade fever of 101 Fahrenheit or lower, blood in the urine or hematuria, inflammation of the bladder, inflammation is just swelling, and asymptomatic bacteriuria. So what that means is essentially there's not going to be any bacteria, there's not going to be any signs with your urinary tract infection. It's going to be kind of, at one point you're going to be good, and the next minute you're going to have an upper urinary tract infection. So make sure you're definitely going to your doctor and making sure you don't have any bacteria in your urine. So from that lower urinary tract infection, like I said, the bacteria is going to try to swim up these ureters right here and enter that upper urinary tract. So this is when it gets a lot worse. So you don't want these kidneys to be affected. You're going to have chills and malaise, which is just like a general feeling of being bad, feeling bad, like that under the weather feeling. You're going to have some pain in the flank area. The flank is maybe like your back area right here. So it's going to hurt back here if you're pressing on it. And you have nausea and vomiting as well. Nausea and vomiting is kind of one of those things that just kind of goes along with all these infections. So from there, we're going to figure out how we can prevent a UTI. This is important. So lower UTIs can lead to upper UTIs. And like I said before, those upper UTIs are going to be the ones that are going to impact the mother and baby the most. You can get an amniotic fluid infection, and you can have early labor and low birth weight for the baby. So it is imperative that if there's any problems, if you have any of these symptoms, that you reach out to your doctor. Any of those low-grade fever, high-grade fever, chills, nausea, and vomiting, please reach out to your doctor or your healthcare provider. Staying hydrated. Staying hydrated will allow the your urine to constantly flow and clear all that bacteria out. Ashley, one of my colleagues, she's going to go over dehydration a little bit more later. Practice good hygiene too. So like Edwin said, washing your hands. That'll definitely keep the bacteria away from other parts of your body. But when it does get to other parts of your body, make sure that you're cleaning everything, if you know what I mean. So genital hygiene is also going to be key, especially when you're pregnant. So practice frequent urination. I know we've all got like our jobs and stuff when we like to hold, because we got stuff we got going on. We're doing our job, we're knocking it out, and we tend to hold our urine, especially us nurses. So when you're pregnant, I know you got to go all the time, but you got to go, because that UTI can, like I said, go up the urinary tract into those kidneys and cause problems for not only you, but the baby. And lastly, we can drink cranberry juice. So cranberry juice acidifies your urine and helps in taking out some of that bacteria. I'm sorry, I'm sweating up here, guys. But yeah, drink some cranberry juice, get you all right there, acidify your urine. And yeah, that's UTIs. Again, if there's any questions in the chat, go ahead and put it in there. and we'll try our best to answer it. But for now, I'm going to pass it over to Ashley, and she will get you guys. Okay.
Hello, my name is Ashley. I'm also a sixth semester student at UT Health Science Center. I'll be going over preeclampsia. Preeclampsia is the most common high blood pressure disorder after 20 weeks gestation, accompanied by protein in the urine and decreased urine output. Preeclampsia can be categorized in two different sections. The first one is mild preeclampsia. It shows few, if any, symptoms such as high blood pressure that is 140/90 and protein in the urine. Severe preeclampsia is high blood pressure that is 160/110, protein in the urine, decreased urine production, which will have less than 500 milliliters in a whole 24-hour period, visual disturbances, excessive fluid in the lungs, upper stomach pain, impaired liver function, and decreased platelet count and fetal growth restrictions. We have maternal risk and fetal neonatal risk. Maternal risk would be overactive reflexes, headache, seizures, and low number of platelets in the blood. The fetal neonatal risks are small for gestational age related to the mother's arteries being narrowed and volume depletion that causes decreased fetal oxygen and malnutrition. And there is also premature due to the necessity of early birth, just to make sure that the baby does not get harmed during pregnancy. Some home care preeclampsia, you can monitor your blood pressure, monitor your weight, monitor your urine protein daily, and it's extremely important to advise the woman to report to the doctor if she develops signs of worsening preeclampsia. And preeclampsia can lead to eclampsia, which can cause seizures. And then we're going to go ahead and talk about the importance of drinking water during pregnancy. Water helps in regulating the internal body temperature. Drinking enough water prevents dehydration, which can lead to Braxton Hicks. Water helps prevent urinary infections. Water helps your body absorb essential nutrients. Drinking water helps prevent constipation. And water helps relieve symptoms of morning sickness and nausea. So I will go ahead and give this back to our first presenter, which was Fernando. Thank you.
Well, if you've been listening, water, dehydration, as I am right now. So, dehydration. So, like mentioned before, it is an important component to the pregnant mother and the fetus. And so not only do you need to have more water than usual when you're pregnant, because you need to do so because the baby needs the water as well. It plays a critical role in the healthy fetal development. So staying properly hydrated is an essential component of the pregnancy. So some signs of dehydration that you want to look out for is usually dark yellow urine is one of the major cautionary signs, and maternal overheating, just kind of experiencing symptoms of like, hot flashes and, just probably sweating and things like that. If experiencing these symptoms, the first thing to do, of course, you want to drink water and rest. So when it comes to the severity of dehydration, we have mild to moderate dehydration, can usually be managed by drinking more water. And if the symptoms continue to go on, if you're drinking a lot of water and you're still experiencing these symptoms, you might want to call the provider and explain your situation. So some of the signs of that mild to moderate dehydration would be a dry, sticky mouth, feeling like lethargic or sleepy, intense feeling of thirst, a decreased need to go to the restroom, headaches, constipation, and dizziness. So we just talked about mild to moderate dehydration. So now we're going to go on to a more severe form of dehydration during pregnancy. And some of the symptoms here that include extreme thirst, more of an excessively dry mouth, skin, and mucosal membrane. So that's kind of like around your nose area. And you might be a little bit more irritable than usual. You might be producing little to no urine, or if you are producing urine, that urine is going to be very dark in color, almost like a dark orange. You'll have sunken eyes, kind of looking a little more tired. Your heartbeat and breathing will increase in rates, and your blood pressure will actually be lowered. So these symptoms above that I just mentioned are cause for concern, and if they continue to persist, you need to contact your provider. So the reason why water is such an important component to the mother and the fetus is because it is used actually to form the placenta. So the placenta is which passes nutrients to the baby is also used in the amniotic sac. And dehydration during pregnancy can result in some serious complications. So these complications can include neural tube defects, low amniotic fluid, premature labor, and then poor production of the breast milk. So if you're thinking about breastfeeding, make sure you're taking in as much fluids as you can so that the baby can be fed well. And lastly, it could cause birth defects. So I know earlier I just mentioned that it's used in the amniotic sac. For those of you who do not know what that is, it's kind of like a fluid-filled sac that contains and protects the fetus in the womb. And there are greater amounts of water that need to be used during pregnancy, and this is automatic concern if you have a loss of fluids and they're not being taken care of. Next, we are going to move on to a different danger sign during pregnancy, which is called hyperemesis gravidum. So hyperemesis gravidum is a condition that is seen when the mom is persistently vomiting and also has severe nausea during the pregnancy period. Morning sickness is a common sign in the first trimester of pregnancy. So it is pretty common to see nausea and vomiting, but when it gets too extreme, we're going to cover right now about how to distinguish between morning sickness and hyperemesis gravidum. So what causes this? So we believe that it is caused by the rise of the hormone levels. However, there is not an actual definitive cause. So how do we distinguish this? So morning sickness, you want to look out for nausea that's sometimes accompanied by vomiting. And nausea usually subsides by the 20th week of gestation. Vomiting does not cause dehydration, meaning that if you're vomiting, you will not show those symptoms of dehydration, and you are able to keep your food down. Versus a more severe version of hyperemesis is you will see nausea being accompanied by severe vomiting, and the nausea doesn't really subside, and vomiting in this case does cause severe dehydration, so that's a cause for concern, and it's not being able to actually keep your food down due to the fact that you're always vomiting. So some of the signs and symptoms we want to look out for is increased salivation, excessive weight loss, constipation due to the lack of taking in water, and then you have right here signs of dehydration. So the dry skin, the dark urine, feeling weak, having headaches. You'll see it in the blood pressure; it'll be lowered. You'll have a more rapid heart rate as well. So when you want to actually call the provider is if you're taking in fluids, right, but you're not able to actually tolerate them for about a 12-hour period. You will see blood in the vomit. You'll have abdominal pain, weight loss of more than 5 pounds, and dizziness, and any sort of signs of dehydration. So these signs are cause for concern, and you should call your provider if you're experiencing them. So some of the home remedies, what you can do at home is to avoid any triggers that you eventually will become aware of. So some of these triggers are not limited to certain, they may include, but they are not limited to certain noises, sounds, some odors that you might not find pleasant, tight, restrictive clothing, motion sickness while you're going in car rides, bright lights, things like that. You want to take advantage and eat and drink whenever you're able to at home. So if management at home is not enough, if the hyperemesis gravidum gets severe enough, you actually need to be admitted to the hospital in order to receive those additional interventions. But there is actually no known prevention for hyperemesis gravidum, but there are many ways that you can actually manage it. Okay, so this next section I will be giving off to the next student.
Hello, my name is Leah, and I'm going to be talking about the absence of fetal movement today for y'all. So absent fetal movement is marked by a decrease in activity or cessation of movement. This may indicate possible fetal compromise or even death. So what to look for? An indication of fetal well-being, you will feel quickening. This is the mother's perception of fetal movement, and it starts to occur about 18 to 20 weeks, which is really important to note that it starts between 18 and 20 weeks, because some people might look for it early and then get concerned that they're not feeling their fetus. So that's important to note. And quickening is the fluttering sensation in the abdomen that gradually increases in intensity and frequency as your pregnancy progresses. The indication of no fetal movement is less than 10 fetal movements within 3 hours. And if movements are slowing whenever you're doing the fetal kick counts. Some complications that no fetal movement can cause is fetal hypoxia, so your baby's not getting enough oxygen, fetal growth restriction, fetal death, and preterm birth. So we have the fetal kick count test, which should start being initiated about 28 weeks and continue until birth occurs. This is a non-invasive test that allows the mother to monitor and record movements easily. It's important to do these tests because if there is no fetal movement detected, that could indicate a problem with the fetus, and it's better to catch this early on rather than later. So to do this test, you can use a daily fetal movement log to record the movements. And it's important to begin counting at about the same time each day, preferably 1 hour after a meal, if possible. And to do this, you lie quietly in a side-lying position on a couch or bed, anything that's comfortable. And then you count 3 times a day for 20 to 30 minutes for each session. If there are fewer than 3 movements in each session, record for an hour. And you can record these on the fetal log that you have. So when to call the provider. Call the provider if there are fewer than 10 movements in 3 hours, if the overall fetus movements are slowing and it takes much longer each day to note 10 movements, if there are no movements in the morning, and if there are fewer than 3 movements in 8 hours. All right, so I'm going to pass it off to Annabelle.
Hi, I'm Annabelle. So today I'll be presenting about mental health during pregnancy. So we just finished talking about a whole bunch of physical things to look out for during pregnancy. And sometimes you're so busy like focusing on all that you don't realize that your mental health is also deteriorating. So it's normal to have baby blues and stress about birth of a baby, but when it starts to debilitate your daily life, that's when you may be considered to have perinatal depression. Depression during pregnancy is often unrecognized because you're focusing on all those physical aspects, and also the depression. The symptoms of the depression may parallel those of pregnancy, such as changes in sleep, energy level, appetite, and sexual desire. Some risk factors for perinatal depression include anxiety, life stress, history of depression, poor social support from your family, your partner, unintended pregnancy, and lack of support. Just that. Signs and symptoms include excessive anxiety about your baby, low self-esteem. An example of that's feeling you're not a good enough mother or you're not ready. Finding no pleasure in activities you usually enjoy, poor adherence to prenatal care, and thoughts of suicide. This will affect your baby because you may experience loss of appetite as a symptom of depression. And you may also be disinterested in your prenatal care as a result, and your baby will suffer because it will not be receiving the proper nutrients to fully develop in utero. So it is important to recognize these symptoms and bring it up with your provider because there is treatment for depression during pregnancy. Some treatment include therapy. Therapy can help mothers find different ways to cope with their new changes in their life and establish healthy patterns of thinking. There's also medications you can take that are safe to take during pregnancy. There's a very low risk of birth defects while taking antidepressants, but you should still discuss them with your doctor. And that's the end of our presentation. Feel free to leave questions in the chat. Thank you so much.
Alrighty, well, big thanks to the UT Health School of Nursing students for providing us some amazing information. If y'all have questions, feel free to post it in the chat. Also, if you do have any of these symptoms, make sure to reach out to your provider, your OB, or if you're an NFP client, reach out to your nurse if you have any questions. So thank you so much for joining us today and watching. We hope everybody has a great Thursday and start to the rest of their, hopefully going into the weekend soon. So thank you so much.